Good day, everyone. Doc Mika here, and I welcome you to Module 1. Large animal surgery is not just about cutting. Like a small animal surgery, we did not start with surgical procedures and such. We always start with the assessment or the evaluation of our patients pre-operatively. But why do we do this? Why do we have to check and do some information gathering and laboratory tests, history taking, physical examination before a surgery? Why do we do this? Let's discuss. The pre-operative assessment, or the assessment before a surgery, is done to satisfy the following goals. Number one is we have to determine if the patient is sufficiently healthy to undergo surgery. When we decide to go to surgery, we have a goal. That surgery can be diagnostic or therapeutic. And with any surgical determination, we have to weigh the benefits of doing the surgery and the costs of performing the surgery. Not just monetary costs, but cost to the animal. What will happen to the animal after the surgery? Will it be better? Will the normal function of the animal be the same? Will it be restored? Will it be improved? Or will the function of the animal be less than what it is before? Especially when we are talking about food animals, they have a certain function. For example, dairy cattle, they are expected to produce milk, an average milk yield, as they say, daily, right? So if we subject this animal in anesthesia and surgical procedures and the possibility of getting post-op infections, what is the risk of this animal losing that function and how good that function is before the surgery? So we have to make sure that before we subject the animal to any kind of procedure, may it be sedation, full general anesthesia, elective procedures or emergent procedures, we have to establish that they not only survive after the surgery, but their function would still be the same or would be improved after. All right. Number two, we have to establish the correct diagnosis of the primary disorder. If you deemed this animal needing surgery because of a certain problem, like for example, in ruminants, it's very common for them to get parts of their gastrointestinal system displaced or twisted on itself, abomasal displacements, cecal volvulus, colonic volvulus. So you have to establish the correct diagnosis of these disorders before you go into surgery. You do not want to waste all those effort, all that money, and to induce risk to your animals, and then you're not even sure what it is, unless the surgery that you're doing is to actually find out what's happening. Like what we do in small animals when we conduct exploratory laparotomies. We do not know what's inside, right? That is why we are doing a diagnostic surgery to identify the primary disorder. However, in large animals, especially for example horses, you have to identify first the correct diagnosis before you subject this animal to all those anesthesia and surgical risk, as I've said, so that all those things that you spend and the benefits of it will be sure for that animal. You do not want to do something that is just a waste, right? And might actually put the animal into more precarious situation than it was before. And with the primary disorder, you have to make sure that surgery is the right course of treatment? What if we can address these problems with simple medical management? What if surgery is a waste and we could just cull the animal? Now, these are very common questions that you ask yourself as a farm veterinarian, as an equine veterinarian, and it requires a lot of experience for you to arrive to the correct answer for these questions. When you do a preoperative assessment, you will be able to identify the health status of the animal. Is there a certain level of surgical risk when you subject them to anesthesia? So you, with the knowledge, with the info that you get through the preoperative assessment, you will be able to create a well designed anesthetic plan specific for that animal. This is very much important for horses because horses undergo general anesthesia and they cost a lot of money. So you have to make sure that that anesthesia is enough to induce anesthesia to the animal, but also that the animal would wake up from it after you do the surgery. And lastly, pre-op assessments help identify pre-existing medical problems which may negate the surgery, hindi naman pala kailangan. Delay the surgery. What if we find a hormonal problem, a parasitic problem, a blood problem, for example, an anemic animal or a hypoproteinemic animal? We have to delay the surgery if we are expecting a certain level of hemorrhage during that surgery, especially for cesarean sections and such. And also, some medical problems would complicate the prognosis after the surgery. That if you compare an animal with a systemic problem and an animal which is apparently healthy, clear of any systemic problem, of course, the prognosis would be poorer in the former animal than in the latter animal, right? So how do we start? All right, with all these goals in mind, do not be overwhelmed by it. I think we all know that these are the goals for it, but how do we actually conduct a pre-surgical workup? The pre-surgical workup would be following a same pattern as what we did in small animals. All right, the baseline is always small animals for us. All right, so we're talking about horses, large ruminants like cattle, small ruminants like goat and sheep and swine. Now, we always start with what we call the signalment, right? This is the basic information about a certain animal. So, what are the information that need be collected for a signalment to be complete? All right, for dogs and cats, we talk about the age, the breed, the species, and the sex. And with the sex, it also includes the neuter status of the animal. Is it castrated? Is it spayed? Is it intact? Right? When was it spayed? When was it neutered? Was it a cryptorchid or not? So you have a lot of those information. And that applies as well with large animals, though with some additional information. Like, for example, they don't have names. Large animals usually would have an animal ID. Animals like horses, yes, would have a name. In swine, pet pigs would have a name, but all those in the middle usually wouldn't have. They would be replaced by the animal ID. And with a signalment, you also have to indicate what type of animal it is. When we talk about horses, is it a breeding animal? Or is it a racehorse? Is it used for draft? Or is it used for leisure? Right? When we talk about cattle, are we talking about a beef, a dairy, or a draft cattle? Right? Is it a breeding one? So you also have to identify that. Why? Why do we need to collect these basic information? Signalment, like breed, age, sex, could actually predispose the animal to a certain disease. Okay, as we know, some diseases only occur in males, some diseases only occur in females, right? Also, when you're able to identify these information, that can increase the efficiency of your diagnosis. If you could instantly narrow down your differential diagnosis, your physical examination would be very focused And that could point you into a diagnosis faster than if you don't have any signalment. All right. So when we talk about medical history, that is also including herd management. For horses and cattle, of course, you have to start with a presenting complaint. If you are the farm veterinarian, you're called in the middle of the night um, to check up on a breeding cattle or a breeding cow or a bull. You have to ask why, what's wrong with it, what did they notice. So those would be your clinical signs. You have to identify as well if this animal has history of past surgical procedures, diagnosed before with a certain medical problem. Is it currently taking medications for a certain problem? What is the diet of this animal? This is very important for your breeding animals because they change diet depending on the stage of gestation. So you also have to identify that. You have to ask for records of vaccination, parasite control, like deworming, to make sure that there is no pre-existing medical problem in this animal. All right. With the horses, with cattle, if you want to know if it has any history of surgical procedure, you usually check at the paralumbar fossa. That's the para sa gilid, lumbar, the lumbar vertebrae sa gilid nun. Usually that is where surgical incisions would be placed, and also the right paramedian abdomen, right, to access the rumen. Usually that's the common areas for surgical procedures. Horses is very particular that they get the tetanus vaccination, an updated one. Tetanus is one of the core equine vaccines. Is also one of the core vaccines for cattle. And that's very important because they are always in contact with soil, which is the normal habitat for your Clostridium tetani. Clostridium is given depending on the country that you're in. Clostridium vaccination is usually done 7-way shot or an 8-way shot. It's like your 5-in-1, 6-in-1, 7-in-1, 8-in-1 in dogs. It's just because of the leptospira bacterium. Same thing with the cattle, but for Clostridium, because there's a lot of Clostridium subspecies that cause problems with in cattle and horses. Like for example, Clostridium chuveoi that causes blackleg. Clostridium cereveli would cause malignant edema. Novi would be black disease, and of course, Clostridium perfringens would cause different types of enterotoxemia, and Clostridium tetani would cause tetanus, which is very much lethal for horses and cattle and any other mammal, right? Unless you have the antitoxin for it. What else? For small ruminants, getting a accurate medical history would be quite challenging because with the way that they are handled, they're usually just tethered in one lot, left to pasture, and then they're herded probably at night. Depends, especially here in the Philippines, wherein they're usually just pinapahawalan lang sa isang lote, right? So it's very challenging to get all those information unless they are breeding animals and they are kept under close supervision by caretakers. You would have information about that. But a lot of the backyard racers would be quite challenging. And if you do your physical examination or if you try to collect data from a distance, they usually don't show signs of illness to strangers. And in swine, commercial pigs, all the info that you will get would be production parameters. Back fat, gestation, ilan yung litter mates, and such. However, with pet pigs, which is quite the demand right now, the Vietnamese pot bellies, the approach for them would be same as companion animals. How we collect a medical history from dog owners and cat owners, pretty much the same thing for pet pigs. For laboratory tests, ano ba yung mga tinetest natin for equine and large ruminants? All right. So usually, if a horse is less than 4 years old, or it's physically healthy, meaning the physical exam is not showing any significant findings, everything is normal, a test for packed cell volume and total protein would do for surgical procedures, especially if you're not expecting that much of a blood loss. However, if horses are more than 4 years old, or there are signs of physically ill, or they are showing, they have a history of a certain systemic problem, you could go higher with a CBC and a full chem panel. More tests, again, can be done depending on the physical examination. You could do RADS, you could do ECG, which is very common for horses, that they do a cardiac workup, and of course urinalysis, right? One thing that's very particular with horses' urine is that they have a higher urine specific gravity as compared to other animals. So when you do your normal physiological parameter report, I have to see that the USG for equine would be quite higher. Right? It's around 1.025 to 1.04. I'm not sure. Pero mas mataas siya. For cattle, though, some laboratory tests would actually point you to a certain problem immediately. And some of these laboratory tests are routinely done, especially for valuable cattle, like breeding cows, breeding bulls, those with a very high milk yield, for example, breeding cows and bulls for beef cattle, which produces a very good calf, well-muscled, good weight gain calf. So, mas routine sa kanila ginagawa. Now, endoparasite screening is actually standard for all animal species. You have to check if there is any presence of, endoparasites, worms, flukes, things like that. Very common, like shola for your cattle. Electrolytes would actually, if there is a problem with the electrolytes, usually that would be significant for abomasal disorders. Renal enzymes, if you're suspecting suspected urinary diseases. Full chem panel can be done if the animal is aged or it has some systemic considerations. Fluid analysis, especially for our ruminal fluid. You can collect ruminal fluid. Remember the contents of the rumen? You remember that? I try to remember that, but sometimes I don't get that. I'm not really good at large animals. As you may know, I've repeatedly told you guys that. All right. So the content of the rumen. This is the rumen fluid analysis. It can be collected through a gastric tube. You assess the color. You assess the pH. If it's too foamy, like there are multiple bubbles in the ruminal fluid that you collect, that could be indicative of frothy bloat, right? And a lot of things could be done in fluids, like gram staining, microscopic exam, sediment analysis, and such. Urinalysis is usually routinely done for dairy cows to assess or to screen for ketosis. And CMT is classic for dairy cattle for California. Mastitis test, which is done usually magkasabay with the urine ketone test. They are interpreted the same time. For small ruminants, usually PCV and TP would do routine fecalysis, as I have discussed. And usually your assessment of the small ruminants would rely more on a physical exam. Swine, though, you do not do lab tests commonly in pigs unless it's for disease surveillance. If you're collecting blood, collecting anal swabs, rectal swabs, to screen for any viruses, to screen for any commensals in a certain herd or in a certain flock. However, pet pigs, again, the approach is the same as companion animals. Now, this is just a table for how to manage a tetanus vaccination in horses. Right? So just read this. This is the most recent guidelines for vaccination for horses, but this is, I think, UK based. I'm not sure. So, how do we do physical examination of horses? Same thing as small animals, you have a from a distance examination where you don't have to touch it yet, and you can deduce a lot of things already by examining animals from a distance because we know that they could change in behavior. We could induce stress to any animal if we restrain them or we put them in a chute or we hold them physically. So, as much as possible, gather as many information as you can while observing an animal from a distance. So, what are these information that you can get? Number one, general condition, responsiveness, and behavior. Horses rarely lie down. That's one thing that I always remember. A horse lying down is bad. They always stand up. They have that apparatus that even if they're sleeping, they're standing up. I forgot what that is called. You know, the DDF tendon and the SDF tendon, they're locking sa paa nila. So they have that stay apparatus. Oh gosh, stay apparatus. My equine professor would be so mad at me. We're friends anyway. Of course, from a distance, you can assess the body condition score. I have discussed the certain anatomic locations wherein you focus on in assessing the body condition score. I will show you the slide later. You assess the character and rate of resting respiration. Before you actually induce stress to the animal, before they get scared, before you put them in a chute or restrain them, you have to assess how they're breathing. All right? How deep are those breaths? What is the resting respiratory rate? And we actually do this for small animals as well. We always ask owners, how is it breathing at home when it's sleeping? Because when they go to a clinic and they get scared, that everything goes up: temperature, heart rate, respiratory rate, pulse rate. So your physical examination would be tainted if you only base your diagnosis on that. You have to check for signs of abdominal pain, of course. How do we know if an animal is in abdominal pain? They're restless, they are kicking at their belly. You see that they are trying to kick at their belly. This also applies to small ruminants and large ruminants. And they're restless, they strain. So some would have referred pain that they would have non-weight bearing on one of their limbs, but there's actually nothing wrong with that limb. They actually have abdominal pain. You also can assess lameness and gait abnormalities in horses from a distance. All right. So systemic evaluation of horses is usually done from cranial to caudal. You start with the head and neck, right? Check for asymmetry. Check the lymph nodes, the submandibular lymph nodes. If they are inflamed and enlarged, that could be indicative of strangles caused by strep equi. What else? You check the sinuses because the sinuses of the horses are very much developed. They have the big sinuses of their nose. So you have to check are there asymmetry pag tinignan mo yung horse na nakatapat sa'yo. Is there, and also we cannot emphasize enough the importance of an oral exam in horses. I think I wasn't able to say this in the actual Zoom, but the importance of oral exam, especially if you have horses that are not eating, and then you think probably have a colic, probably have a limp or a problem systemic that it's very complicated. It's probably a problem with the teeth, because it's very common for horses. That's why you have dental floating. That's why they require, regular oral examination for horses. You have to check if there are spurs happening because they usually, we're going to have a lecture about this, but they usually, they don't stop growing. All right. And the anatomy of the horse's upper jaw and the lower jaw ay hindi sila magkatapat talaga. That's why you have overgrowth on the lateral side of the upper and on the medial side of the lower. All right, so we'll discuss that more, but that requires attention, of course, especially if your animal is restless, it's pawing at its mouth, it refuses to eat. All right. Examination of the ventral thorax and abdomen. I think I remember Sura. Sura is caused by a Rickettsia, a protozoa. Oh gosh, I'm really bad at para. Trypanosoma evansa is very common for horses in the Philippines. Causes Sura, causes that the ventral skin of the thorax to the neck would be sagging. Very common. What else? The cecal and colon contractions, of course, because the colon is very much well differentiated in the horse. So it's very common for it to be displaced, to be twisted, or cecal volvulus, as they say. So you have to be. There are a lot of videos in YouTube. I'll put them as a comment so that you could actually hear the pings when they record it. Musculoskeletal examination, which is one of the most common disorders in horses. They would have swellings, they would have asymmetry, they would have arthritic problems on their limbs. That is very common. So you have to check those limbs as well. And remember, they kick. So do not position yourself behind the horse. Okay, always on the side. And of course, pulse rate sites along with musculoskeletal examination is done because one of the pulse rate sites would be the digital artery, very palpable. And you could also use the facial artery on the lateral side of the face. Now, this is one of the grading systems for a body condition score. Body condition score grading. I think this is wrong. BCS score. Anyway. So these are the sites wherein you focus on. One would be behind the shoulder, 2 would be the fat covering the ribs, 3 would be above the tail head, 4 would be along the backbone, meaning your thoracolumbar vertebrae, 5 would be the withers, that's how you measure the height of a horse, and the 6 would be the thickening of the neck. You have to check for that too. Now for ruminants. How do we examine large and small ruminants? I will be focusing more off on, not really focus on. Basically, the way that you examine them would be the same. It's just that cattle and goats and sheep would have a very big disparity in terms of size. So imagine doing a lot more of your physical examination in a sheep and goats while they are handled or restrained or in chute. All right. Commonly, dairy cattle would be, arranged in individual chutes already as they're eating, especially if they are currently kapag buntis ang cows. Gosh, nawalan ako ng English doon. When they're pregnant, right? When they're lactating as well, usually separated into individual chutes. Heifers would be in pens of 5 to 8, depending on the farm. So bulls would always be separate. So sometimes your from a distance examination with ruminants is always leads to in chute already. You don't really examine them while they're in a herd or in a flock unless you are examining beef cattle wherein they're always together, right? So from a distance, what would be the general condition and behavior of a cattle? They would normally lick their nose. That's a normal setting for them. They are, again, chewing. They're ruminating, as we know. They regularly pass manure. All right. So sometimes with those normal behavior, you could actually see if there's a problem already when they're not doing that. You also have to observe them when they're resting, and when they are in motion. You also, when you see cows that are recumbent on the floor, like they're lying down, and they try to get up, examine as well how they stand up, what leg do they favor, what legs seem to be not used as much. Sometimes the depth, yung pag-apak nila sa kung ano man yung bedding nila, you could actually see if one limb is less weight bearing than the other. Kasi mas nakaangat siya, you could actually see more of the hoof as compared to the other leg. So that is one indication that that limb could be, less weight bearing. It could be in pain. There could be a problem with the hoof, or there is another, more complicated problem. Assess the character and rate of respiration. Classic. Same signs of abdominal pain as horses, and lameness, muscle asymmetry. Classic from a distance. All right. They kick as well, so be careful when you examine cattle, and even goats and sheep can be quite temperamental. It depends, especially if a buck is not castrated yet. So you have to be very careful. So systemic evaluation, again, cranial to caudal, but do not be surprised if some farms or some veterinarians have their own way of doing it that is governed by their experience already. So it's not like a ultimate, sacred rule that you start from cranial to caudal. If you find something in the limbs, then you don't have to wait until you're done with the head and neck and the thorax until you check that limb, diba? But always classic is rectal examination must be done last. You should not be in a hurry to find out the temperature of an animal. One way for you to actually check, if you do not have a thermometer, sometimes you can check the pinna, the ear cartilage of these animals, the horse, the small ruminants, large ruminants, even pigs, and check if they're cold or warm to touch. That could actually give you an idea if they're hypothermic or not. What else? Vital signs measurement, you should be guided by your report there. Hydration assessment, how do we assess the hydration of these animals? Yes, we could do a cervical skin tent wherein we use the ventral cervical skin. We could also use the skin of the palpebrae. The moistness of the nose, which is classic even for dogs and cats. And also the depth of the eye relative to the orbit, right? Because we know if it's too... I call it malamlam yung mata. Right? You know it. The eye should be a little bit protruding outside. If it's too deep inside the orbit, there could be a deficiency in the what do you call this? Aqueous humor of the animal. So that's one thing that which makes the eye like go deeper to the orbit when they're dehydrated. Urine collection is very much straightforward for ruminants. They urinate whenever they're disturbed. That's a normal behavior for them. It's easy to collect if you wanted to just test for ketones routinely for dairy cattle. But if you're going to test for culture and antibiotic sensitivity testing, especially for animals that you are giving antibiotics to and you wanted to make sure that they're not resistant to it, then you have to catheterize the animal and get, a sterile sample of urine. Common diseases for them, hypocalcemia can have classic clinical signs. They have muscular fasciculations, they're downers, that could also be indicative of ruminal hypomotility sometimes. I'm gonna leave it to medicine, ruminant med, to discuss all that. The bloat, what to do with bloat, what does it mean when it's chocolate like ruminal fluid. I'll leave it for med. Okay? I'll focus on the surgery. What else? Very common is mastitis, especially for dairy cattle. Colic, of course. Lactic acidosis, volvulus, and hardware diseases. Hardware diseases or peritoneal, pericur. I'm not gonna try. It's a long name. All right. What's hardware disease? I'll leave that to you. All right. This is one way to assess the BCS of cattle. This is beef, I believe. Now for pigs. Okay, for pigs, basically, if you try to assess them from a distance, you try to restrain them in a chute or you carry them, they're gonna resist. They're very stressed animals. All right? They're gonna squeal like they're dying already. That's how pigs are. In my experience with pet pigs, because I think I have never handled a client with a pet pig. I've seen one. But uh, this pig is very, because lagi siyang hinahawakan, so it's very docile. So, hindi siya masyadong nag-struggle when we're trying to collect blood and such. But it was cool. It's just like a pet dog. It's cute. It's fat. Ganun naman ang pet pigs. So cute. Now, for when you do surgery kasi in pigs, they usually done sometimes for medical purposes, right? Because the anatomy of the humans and pigs there are some we call it similarities to it. So sometimes some medical surgeries are done to pigs by medical students, studying to be doctors. So yun yung mga alam ko mga surgery ginagawa sa pig talaga. But in a commercial farm, the usual procedure that's done to pigs are just necropsy, not really surgery because of the economic value of the pig. You wouldn't want to spend so much on a pig because there's you could simply cull them if there's something wrong with them. But right now, medyo may shortage tayo sa pigs. So, baka iniingat-ingatan nila ngayon yan. Right? One thing that you have to observe in commercial pigs is that how they interact with other pigs in the pen. That actually gives you an idea. If this pig is downer, it prefers to be by itself when others are eating, mingling with each other, and then this one is just all alone. There could be something that's wrong with that pig systemically. You have to expect that sows with piglets would be extra aggressive to you. They bite as well. That's why rabies is also one of the vaccines given to pigs. What else? Now, yes, you have to employ minimal restraint as possible because they just squeal. They just, you think they're dying already, but you're just checking you're just collecting blood. That's how they are. Some actually would die because of, too much stress. The integument is one thing that actually points you to a certain disease. I know you know that. Not just because of greasy pig disease or diamond skin disease. There's a lot of conditions that actually have a skin manifestation pathologically. Where do we assess mucous membrane colors of pigs? On the vulva or anus? Hydration assessment, skin tint method is not quite done. You can try, but since they're very much the skin is very much stretched, medyo mahirap. So you usually just assess with a palpebrae as well, the nose. Gastrointestinal assessment by fecal examination is routinely done. You assess the color, the consistency, a lot of the conditions, and pathological diseases happening to pigs, which may or may not necessitate surgery, is affecting the gastrointestinal system. The reproductive system would, of course, have a special, focus in breeding animals, especially if yun yung mga source mo ng semen for artificial insemination, for those breeding stocks that are imported from abroad to here. So those are very important, right? Lymph nodes, do not expect to be able to palpate them because you can't. If you can palpate for a lymph node, there's something wrong there. Okay? Unless that pig is emaciated. Of course, you would be able to feel a little bit of lymph node. But if it's, a good body condition score, you wouldn't be able to palpate for any lymph node there. So BCS, again, this is for a pot-belly pig. All right? They're pigs, we don't want them to be too fat, of course. There's always such a thing as too fat and too thin for pigs. All right? So this is just a table by the American Society of Anesthesiologists. how to classify, the physical status and the recommended tests. I think I discussed this in surgery 1. Physical status of 1 to 4, could be to 5. I just went for guarded. This is for horses actually. So, meron siyang corresponding laboratory tests that are required for it. But again, of course, it depends on the existing protocols in the farm that you are in. So overall, your surgical judgment, which is honed through time, through experience, and exposure to different kinds of animals, would be the entire, doon nakadepende yung surgical plan mo. Alright? You have to approach large animals and companion animals differently. Number one, companion animals, I'll include horses here as well, would have, that very significant sentimental value, wherein the cost of surgery would ultimately outweigh that. Now, a family's horse owners, would be willing to spend thousands of pesos or dollars to treat the animal and prolong its life, or to treat a certain condition. Diba? However, when you approach cattle, smaller ruminants, commercial pigs, you have to check the economic value of it compared to the cost of surgery. If it costs too much to do the surgery, and then your prognosis is like poor to guarded or grave, and then you're not even sure what will happen to the animal, then some farm owners would actually say, or even you would actually say, let's just cull this guy. I'm not gonna trouble myself with it. I'm not gonna trouble the pig about it. Let's just cull it and move on. Okay? Because usually for those animals, from my experience, from my very limited experience in ruminants and horses, the even pigs, the usual problem that needs a little bit of surgery is a skin laceration. Especially for horses, their limbs would be caught on a wire, on a fence, and that needs a little bit of surgical attention. Hanggang dun pa lang yung lagi kong nakikita for my very young 7 years in practice. Okay, I've seen a horse under general anesthesia, but it's just because they what do you call this? They did arthrocentesis. They collected a joint fluid from it, and it can't be done for that horse nang gising siya. So, it's not even, treating something. But then again, that's Philippines. When you go to a country wherein agriculture-centric, or sila yung pinanggagalingan ng breeding stocks and such, or the main business for those are horses, like they have polo matches, or they have race horses, of course, the approach would be very different. They would be very advanced. You would have surgeries, just to address tendon problems in horses, because they are expensive and they cost so much if they would just put to pasture. Diba? Para siyang, shinut down mo na yung horse when you say put it to pasture. It's done racing. It could be used for breeding, but it depends. So you have to weigh that. And that is a big conversation between you and the farm owner and the other caretakers as well. Okay? You also have to consider the level of necessity and urgency of the surgical procedure and your capability to conduct the procedure or to perform the procedure. Does this cow need cesarean section right now? Can I do it? Or is there time for another veterinarian to be called in for a referral, and then siya yung gagawa ng surgery and I will just help? Now, those are things na kailangan mo isipin. If it's an emergent procedure and you can do it, then do it. Diba? If it's not an urgent procedure, can you transfer the animal to another farm, like horses? Sometimes it's done. You transfer the horse from one province to another kasi nandun sa kabilang province yung surgical area or surgical, the surgeon. Meron siyang center doon. So you have to weigh those two. All right, when you decide on conducting surgery in large animals. There's a lot more factors pagdating sa large animals na non-medical. Okay? Because you have to consider the cost, you have to consider the resources, you have to consider your own capability to do it. And it's very rare that you do, what do you call this? Procedures in large animals alone. It's not like spaying a cat, right? In doing cesarean sections of a cattle, you need a lot of people to help you. Okay, so that's also a big factor to weigh into, right? So that is our what do you call this? That is module 1. Yay! Next meeting or next week, I will be starting with, I forgot. Oh, I think it's a septic technique. Gosh, this is why it's hard to handle like 4 subjects in a sem. It's just crazy. I'm thinking of another subject already. Module 2 is about aseptic preparation and surgical. I will also include surgical instrumentation as well for module 2. So I will see you again next week in the Zoom meeting. And if you have any questions about this module, feel free to email me or send me a personal message in Facebook Messenger. Thank you, everyone. Have a good week.